Hey everyone, welcome back to our channel. In today's video, we're going to talk about migraines, one of the most burdensome neurological condition that affects millions of people worldwide. We'll discuss the causes, symptoms, and treatment options available for those who suffer from this debilitating condition. So, let's just get right into it. Migraine is a neurological condition characterized by recurrent episodes of moderate to severe headaches and pulsating pain on one side of the head. That can be accompanied by a range of symptoms such as sensitivity to light, sound, or smells, nausea, and vomiting. The pain is caused by the activation of nerve fibers within the wall of brain blood vessels traveling inside the meninges. Migraine headaches typically last from a few hours to several days and can be disabling, causing significant disruption to daily life. The exact cause of migraines is not fully understood, but it is believed to involve a combination of genetic, environmental, and neurological factors. Migraines occur in both children and adults but affect adult women 3 times more often than men. Most migraine sufferers have a family history of the disorder. Those with migraine are more likely to have depression, anxiety, bipolar disorder, sleep issues, and epilepsy than the general population. Migraine in women is often related to changes in hormones and can begin at the start of the menstrual cycle or during pregnancy. Most women see improvement after menopause, but surgical removal of the ovaries usually worsens migraines. Women with migraine who take oral contraceptives may experience changes in the frequency and severity of attacks, while those who do not suffer from headaches may develop migraines as a side effect of oral contraceptives. Migraines usually appear before 40 and peak in midlife, affecting those in their prime working years. Migraines are most common in the morning, especially when you first wake up. Some people have migraines at predictable times, such as before menstruation or after a stressful week at work. Many people feel exhausted or weak following a migraine but are usually symptom-free in between attacks. Routine physical activity, movement, or even coughing or sneezing can worsen headache pain. Several different factors can increase your risk of having a migraine. These factors, which trigger the headache process, vary from person to person. A trigger is something that happens to you or something you do that results in you having a migraine attack. These triggers can be sudden changes in weather or environment, too much or not enough sleep, strong odors, emotion, stress, overexertion, loud or sudden noises, motion sickness, low blood sugar, skipped meals, tobacco, depression, anxiety, head trauma, hangover, some medications, hormonal changes, bright or flashing lights. The clinical course of migraine is divided into 4 phases, all of which may be present during the attack. Phase 1 is called the PRODROME phase. It is believed to occur due to activation of the hypothalamus. Symptoms occur up to 48 hours before developing a migraine and may include food cravings, unexplained mood changes like depression or euphoria, uncontrollable yawning, fluid retention, increased urination, nausea and in some cases, vomiting, fatigue, neck discomfort, sensitivity to light. Phase 2, or the aura phase. Cortical spreading depression is considered to be the primary cause of this phase. Cortical spreading depression, or CSD, is a burst of neuronal activity followed by a period of inactivity. The aura phase lasts for 5 to 60 minutes. Some people will see flashing or bright lights or what looks like heat waves immediately before or during the migraine, while others may experience muscle weakness or the sensation of being touched or grabbed. Phase 3, or the headache phase. Clinical evidence suggests that several neuropeptides, including calcitonin gene-related peptide, or CGRP, are involved in migraine pain. Classically, the headache is unilateral, throbbing, and moderate to severe in intensity. It usually comes on gradually and is aggravated by physical activity during a migraine attack. It is also possible to have a migraine without a headache. The headache phase usually lasts from 4 to 72 hours. Individuals may experience nausea, vomiting, sensitivity to light, and allodynia, a condition where the person experiences pain in response to a non-painful stimulus, such as light touch, pressure, or even a change in temperature. They may also experience fatigue and neck discomfort. Phase 4, or the POSTDROME phase. This is the phase after the migraine headache has settled. The precise cause of this phase is not known yet. Individuals are often exhausted or confused. The POSTDROME period may last up to 48 hours before people feel healthy again. Some people feel unusually refreshed or euphoric after an attack, whereas others note depression and malaise. For others, this can vary each time. According to the ICHD, or International Classification of Headache Disorders, migraine has been classified into 6 main subtypes, but that is a whole other discussion. If you would like to learn more on the subject, please comment below and I will try my best to come up with it. The diagnosis of migraine is based on the signs and symptoms. Neuroimaging tests are not required to identify migraine, but they may be used to rule out alternative causes of headache in patients whose examination and history do not confirm a migraine diagnosis. According to the ICHD, or International Classification of Headache Disorders, the diagnosis of migraine is more likely if a person has 2 of any of the following symptoms. These are: number 1, 5 or more headache attacks. Number 2. Each attack lasts for 4 to 72 hours. Number 3. Each attack includes at least 2 of the following. The headache has a unilateral location, which means it affects only one side of the brain. The pulsating quality of the pain. Pain is of moderate to severe intensity. Pain is worsened by or causes the individual to avoid routine physical activity. Number 4. Each attack includes at least one of the following. Nausea and/or vomiting. Sensitivity to light and sound. If you or your close ones are experiencing any of these symptoms that cannot be explained by any other disease, you might want to consult your healthcare provider, as you might be suffering from migraine and have had experience with a migraine attack without even knowing you had it. It is believed that a significant number of people with migraine still remain undiagnosed. There are 3 main aspects to the treatment of migraine: avoiding triggers, treating symptoms, and using medication to stop further attacks. As mentioned earlier, several factors may trigger or worsen a migraine attack. Identifying and avoiding these triggers is the first step to managing your migraine. Some quick steps to relieve migraine symptoms include napping or resting with eyes closed in a quiet, darkened room, placing a cool cloth or ice pack on the forehead, drinking lots of fluids, particularly if the migraine is accompanied by vomiting. Small amounts of caffeine may also help relieve symptoms during the early stages of a migraine attack. Drug therapy for migraine is divided into acute and preventive treatments. Acute therapy is recommended for all individuals with migraine to achieve rapid relief from pain and associated symptoms and to restore their ability to function. Preventive therapy involves taking medicines daily to reduce the severity of future attacks or prevent them from happening. Medications are more effective if used earlier in an attack. The frequent use of medications may also result in medication overuse headaches, in which the headaches become more severe and more frequent. Due to these concerns, simple analgesics such as paracetamol are recommended to be used less than 3 days per week at most. I won't go into the specifics of the medications prescribed because the purpose of this video is to raise awareness of the disease. If you or a family member is suffering from a migraine or there is a suspicion of the condition, please consult your healthcare professional for further medical intervention. Lifestyle changes such as exercising, avoiding foods and beverages that trigger headaches, eating regularly scheduled meals with adequate hydration, stopping the use of certain medications, establishing a consistent sleep schedule, and practicing relaxation techniques such as deep breathing, yoga, and meditation are some natural remedies for migraine. Weight loss programs are advised for obese people because obesity raises the likelihood of having chronic daily headaches. In conclusion, living with migraines can be challenging, but there are ways to manage the symptoms and improve your quality of life. Remember to listen to your body, take breaks when needed, and seek medical advice if your migraines are affecting your daily activities. With the right treatment and support, you can overcome this condition and enjoy a fulfilling life. Thank you for watching, and I hope you found this video helpful. Don't forget to subscribe to our channel for more informative content like this one.